As I mentioned, here's our participants. And Dr. France, will you start us off today?
Yes, thank you. And thanks everybody for joining us. I know this was a bit of a last minute push, but we wanted to be sure we were available to you to answer your questions about how the state has been reporting COVID-19 deaths over these last couple of months. I think it's important as we go through this to recognize first and foremost that there really are two streams of reporting for COVID-19 deaths, and their purposes are different. The first one is really, if you think about it, death certificates. In the US, everybody gets a death certificate. An immediate cause of death and the underlying cause of death are both expressed on those death certificates. And the information of those are used for research and a variety of purposes. And so in a death certificate, you would typically, and we'll show you an example here, identify persons who die from COVID-19. They may immediately die from respiratory distress or pneumonia, but underlying that could be an infection by COVID. And you'll see that on the death certificate. That's one stream of reporting. The second one is about what we're doing in public health. And in this instance, it's really about surveillance work where it becomes very important to have a standardized case definition that's used across the United States so that we all understand what we're talking a death looks like for someone who has COVID. And so I'm going to just change my view here so I can see this a little better. But you see here that we have been reporting at the state deaths among people who had COVID at the time of death. And the cause of that death may or may not actually have been COVID-19. And we've been doing this to align with the recommendations, as you see, from the Centers for Disease Control. Doing it for public health surveillance allows us to do the kinds of apples to apples comparisons across states or cities where everybody's using the same definition. Again, it's a definition that's distinct from what you see on the death certificate. Next slide, please. Great. So you can see that even here. Oops. As I was just describing it, there are two different ways that the state reports these deaths. The first is by physicians, medical examiners on the death certificate through the routine death certificate registration process. And the second one is what gets reported into public health to the state epidemiologists and then is shared with the CDC. Let me turn it over to Kirk or Alex to talk a bit more from here, and then Rachel will be jumping in as well. Not hearing Kirk, I will keep going.
Hang on a moment, Dr. France, if you want. I think Alex might be muted.
Okay.
And sorry, 1 second. Kirk is as well. So Kirk or Alex, if you want to unmute, go ahead. But if not, if you're having technical difficulty, Kirk, is that you?
Yeah, no, this is me. So thank you for unmuting. It's working fine. So yeah, thank you, Dr. France. And my name is Kirk Ball. I manage Colorado's Vital Statistics program. And in that role, I oversee the program responsible for the analysis and dissemination of Colorado's vital records data, that is birth statistics, death statistics, and so forth. So I'm grateful for the opportunity to chat a little bit about one of these standard data reporting streams, that is deaths caused by COVID-19 and all other deaths occurring within the state of Colorado. So if we could skip to the next slide, please. Or actually, we can stay here for, I'm sorry, go back one. I'm sorry, I got turned around. So as Dr. France mentioned, there's two ways in which deaths get reported to the state. This first one by physicians, coroners, and medical examiners through routine vital records or death certificate registration. That information is intended, as Dr. France described, to capture the best medical opinion of the medical certifier, that is the coroner, medical examiner, or physician who's completing that death certificate, including deaths found to be caused by COVID-19 or other causes as well. That information gets registered within the state health department through routine vital records registration. And we use that as one source of information for deaths among cases of COVID-19. And so we do routinely share information from death certificates to the COVID-19 epidemiologists, and they incorporate that information into their system as well. These death certificate data also get reported to the Centers for Disease Control, or CDC, specifically the National Center for Health Statistics, who rolls this information up from vital records offices all across the country in order to produce national level vital data for the country. So if we go to the next slide, please. This presents a little bit more information about this CDC case definition. I'm going to defer to Dr. France and Dr. Herlihy a little bit more about this, because this is tied more in with the deaths among cases component and reporting that Dr. France described. So I'm going to jump into the next slide, which is an example of how a death certificate might look when it's being completed for a death due to COVID-19. Again, we capture the immediate ailment that resulted in death, but also that underlying cause, that is that health condition, but for which the person does not die. And so COVID-19 in this case is determined to be the underlying cause of death for an individual whose death certificate would be completed, such as this, where COVID-19 resulted in pneumonia, and most acutely with acute respiratory distress syndrome, unfortunately, but ultimately resulting in this person's death. And so this is information that is completed for all death certificates for the state, not just COVID-19 related deaths for the state. It is important that we do capture accurate reporting of COVID-19 on death certificates for all decedents where COVID-19 is known or assumed to have caused or contributed to death. We do rely on our death certifiers, that is our coroners, medical examiners, and physicians, and their best medical judgment and professional opinions and the information available to them to determine the cause of death and report it through death certificate. We do ask that these medical certifiers include as much detail as possible based on their knowledge of the individual's case, medical records, laboratory testing, and so forth, as well as other chronic conditions or that the decedent might have had that contributed to death. We would emphasize that COVID-19 should not be reported on the death certificate if it did not contribute or was related to the cause of death. One thing I did want to make sure folks were aware of is that the information as collected on the death certificate as a legal document, again, is that best medical opinion of the certifier, the coroner, physician, medical examiner who's completing this. CDPHE does not alter or change this information in any instances, certainly not unilaterally. That is to say, we do not question the information as reported on the death certificate, nor change that information. So we take what is reported on the death certificate to us, and then we share that with the CDC, and together we process that information to ultimately compile official vital statistics for the state and the country. Where a physician, coroner, medical examiner might want to amend a cause of death or change a cause of death on a death certificate based on new information or a completed death investigation, there is a formal process by which they can initiate an amendment to a death certificate. But again, CDPHE does not change the cause of death or modify this information unilaterally as reported on the death certificate. We do
I could
through,
I just
ahead,
add,
Dr. Prince.
yeah, this is Dr. France again, just added because we have the death certificate up here and it's opportunity for all of us to learn. You'll see that it's divided into a part 1 and a part 2. And in the part 1, you always have to have the sequence of the immediate versus the underlying. And if you look to the right, you see there's always a time interval 2 listed for that sequence of events. If a person had asthma or heart disease or chronic obstructive pulmonary disease underlying their general health, and you felt that also was a contributor, that would be down into the Part 2 section here of the death certificate. So this is where the death certificate on this line C, or underlying causes, would describe the death as underlyingly being caused by this COVID-19 infection.
Thank you, Dr. France. That's very helpful, and appreciate those examples that you provided. We are very fortunate in that the Centers for Disease Control also has published and released a large amount of guidance for how best to complete a death certificate to most adequately and completely capture those underlying and contributing causes of death for death certificates. And through their website and information we provided to our coroner, medical examiner, and physician community in Colorado, we've shared, we continue to share information about how best to complete a death certificate so that it accurately reflects that information. And most recently, the CDC published a short video that's available online as well that walks medical certifiers through what this might look like for a COVID-19 related death, since it is truly a novel situation for many of our medical certifiers. So next slide, please. So ultimately, all of that information that's collected on the death certificate in that text form is distilled by the Centers for Disease Control into a series of cause of death codes, and among which one is determined to be the underlying cause of death. And that underlying cause of death, again, is that disease or health condition, or in the case of an injury-related death, the injury that precipitated the chain of events that resulted in death. And so all of that rich text information, again, is distilled by the CDC. We provide them that information, they process that, and then they return that back to us, and we incorporate that into our own statistical analyses here for Colorado. The code that is used that you will end up seeing in a variety of statistical reports that is assigned for coronavirus disease or COVID-19 is U07.1. It's a new code created for this purpose, and will be the information that we base our official mortality statistics for the state on for COVID-19. Again, these are for those deaths due to COVID-19. It's important to note that physicians are invited and encouraged to list COVID-19 as a cause of death on the death certificate, even without laboratory testing. But if they believe in their best medical opinion that COVID-19 was related to that death and was part of that causal chain. Next slide, please. Again, when COVID-19 is reported as a cause of death on the death certificate, more than likely it will be determined to be the underlying cause of death and contribute to those underlying mortality statistics. But again, if COVID-19 was not determined to be part of the cause of death, it should not be reported reported on the death certificate if it did not cause or contribute. So kind of I got ahead of myself a little earlier mentioning a few of these, but worth reiterating. And next slide, please. And finally, I do want to say that the vital statistics system is a robust and long-standing system reliant on a great many partners within the state and across the country. This is CDC's quote, but we acknowledge that obtaining high-quality cause of death information is challenging, especially during emergencies where there's new information and where guidance may take time to develop for both how to, say, register death certificates, just as in any area of epidemic response, but also for the processing of those death certificates and interpretation of that information. We do recognize the significant efforts of our medical certifier community, physicians, coroners, medical examiners, and the workloads they face on top of all of the other outstanding work that they do around death investigation and certification. And they're not always blessed with the absolute best information or most complete information to make decisions about cause of death. But we do acknowledge that Colorado's coroners are doing a great job with our medical certification, and we stand by to support their efforts. And where questions come up about completing a death certificate, whether COVID-19 related or otherwise, our state vital records office, managed by our state registrar, Alex Quintana, he and his team are available to assist. And we look forward to helping out with these ongoing efforts with COVID-19 and elsewhere. So just wanted to kind of wrap that up with regard to vital records or death certificate registration for the state and get into some of the nuts and bolts there. So I hope that's helpful. I want to turn it over to Drs. France and Herlihy to talk a little bit more about some of the COVID-19 case related information and those distinctions that have been made there.
Great, thank you, Kirk. If we could go back to the slide on the CDC case definition for the epidemiology side of the house. Okay, so what Kirk described to you is this death certificate part of our surveillance system. We have a parallel system that is really primarily based on laboratory reporting and symptoms that individuals are experiencing. And so I wanted to spend a minute to talk about this parallel system, because I think having these two systems in place has potentially created some confusion, and we apologize for that, which is why we wanted to spend some time talking you through these two different systems. So what I'm presenting to you here is information about Colorado's participation in what is called the Nationally Notifiable Disease Surveillance System. And this is a national system that uses very specific criteria that are developed nationally and issued by an organization called the Council for State and Territorial Epidemiologists. And for every disease that is what is considered nationally notifiable in the country, there are these standardized criteria that allow us to ensure that we are comparing apples to apples from one state, so that a case in Colorado is the same as a case in Nebraska or a case that is occurring in Florida. And so we have these distinct criteria to make sure that, you know, we have a systematic approach to counting these cases across our country. And so, as I mentioned, these criteria are largely based on laboratory testing. And so what you can see here is that a confirmed case or death is defined by meeting confirmatory laboratory evidence for COVID-19. And specifically, if you dig into the details of the position statement, what this means is a person who has tested positive for COVID-19, specifically with a PCR-based type test. And so you can see that essentially, or simply, a death is reported here as a case among a person who was infected with COVID-19. So this doesn't make a judgment about whether or not COVID-19 caused that death. It is simply a positive laboratory test among a person, whether that person is alive or has died, that is positive for COVID-19. We also then get into some less strong criteria where we move into talking about probable cases. So these confirmed cases are cases where there are these positive PCR-based tests. And for probable cases, we have a lower level of evidence that is telling us that someone is most likely considered a case, but we don't have the same strength of evidence that we might have with that positive PCR-based test. And so you can see here some of those probable case definition criteria. And we recognize that it is confusing to have these two systems that are operating in parallel. The vast majority of COVID-19 deaths that are reported through this nationally notifiable disease system are going to be among individuals who have COVID-19 listed as a cause of death on their death certificate. But from time to time, there are going to be cases among individuals who had a positive laboratory test for COVID-19 just prior to death or perhaps post-mortem testing, the virus was found. And those individuals are also counted as cases of COVID-19, even if the cause of their death was not necessarily due exclusively or even partially to COVID-19. So it creates these two parallel systems that we recognize can be challenging to interpret. but it's important to make sure that Colorado, like all states around the country, is following the same criteria that our neighbors are following, and counting cases in a systematic way and counting deaths in a systematic way. Dr. France, any additional details you'd like to add to this slide?
All right.
Okay.
Thanks, Rachel.
Thank you.
Dr.
Sorry, I was having trouble unmuting. No, Rachel, I think that's nice. You highlighted the fact that these are two parallel systems, both that provide very important information for the state and the country. On one hand, we're identifying and classifying cause of death by COVID, and on the other hand, we're doing the important public health work of identifying cases who also have died while they had COVID, either from it or from something else, which is important as we do apples to apples comparisons across the state. If we could go to the very end, I'd just like to remind everybody that these are all about numbers, and yet these are real people, real individuals who have lost their lives to this virus. And so I want to remind you that tonight at 7, there'll be a minute of silence, and we're asking all citizens of Colorado to wear a mask. There'll be city buildings, the state capitol, and others that will be lit up red with lights tonight. The fire departments, police stations will turning on their lights. And we hope that everybody in Colorado will participate to take a moment to remember that every number has a name. And with that, we'll take questions.
I want to, before we move to questions, want to share with the folks listening that we do plan to make some improvements to our website and clarify the difference between these two different systems and how they are counting cases and deaths. So you should see some updated information on our website tonight and then over the next couple of days as well.
Thanks, Rachel.
Okay, all right. With that, thank you, everyone. We'll go ahead and take questions. So when I call on you, if you could please say your name and the outlet that you're with, that would be greatly appreciated. First, I have on the line David Clue. You are unmuted. Oh, one second.
Can you hear me now?
Yes, we can hear you now. Thank you.
Very good. Thank you. David Clue with Denver 7. Based on the confirmed and probable cases slide that you were just showing, the governor may have been a bit off base in responding to Mr. Yellow's death in Montezuma County when he said that no one sitting behind a desk, referring specifically to CDPHE, should ever be second guessing a county coroner. What's your response to that comment and his criticism of the way you were counting COVID-related deaths in that county?
Sure, this is Rachel. I can take that question. So I think it's important to recognize that, you know, the system that I was speaking about, this nationally notifiable disease surveillance system, is not changing death certificates. It is not making a judgment about a cause of death, or certainly is not questioning a healthcare provider or a coroner's decision-making and what is documented in a death certificate. It is a system that is really independent of that. So they're different systems. They are counting data in a different way. So I think it's important to recognize parallel systems in play here that overlap in some ways, but certainly not completely.
Yet, if I can follow up, am I still?
Yes, you're still on the line.
If I can follow up, it increased the number of cases in that county, and I think that's what the governor was responding to. So at the end of the day, when CDPHE says someone died of corona when in fact the coroner says they died of alcohol poisoning, how do we mix and match that?
Yeah, so I think we recognize that there certainly has been confusion around this topic, and this is why we really want to start providing some additional clarifying information on our website that really distinguishes between individuals that have a death certificate that has been coded as, their death being due to COVID-19 versus an individual who may be alive or has died that had a positive COVID-19 death. So I think the difference is looking at individuals who had COVID-19 and died versus individuals who had COVID-19 listed as a cause of death on their death certificate.
Thank you.
Next on the line, I have Marshall Zellinger. You're on the line.
Thanks for doing this. Also from the governor's news conference, when I asked the question, he talked about the difference between that CDC requires all this data, but there is a difference between dying of COVID-19 and dying with COVID-19. This complaint from State Representative Mark Baisley to try to have criminal charges filed against Joe Ryan comes from a Summer and Glen community in Centennial, where last month they put out a notice saying we had 4 deaths, but CDPHE now says we have 7 because they changed the death certificate. So I know it's a convoluted question, but in relation to this specific place, are we dealing with people who died with COVID-19 that are designated as COVID deaths, or did they die of COVID-19?
Marshall,
go ahead.
Well, I was just going to say that I don't have the details on what those 4 or 7 cases are at this time. I'd be very interested in learning more about what it means that the state changed the death certificate. As you've seen today, those are decisions made that are medical opinions by the coroner, medical examiner, or physician. And there isn't a process by which we review and change them at the Department of Public Health.
Thank you. Next on the line, I have Chris Vanderveen.
Hi guys, can you hear me?
Yes,
Yep.
we can hear you.
So my question, it's going to be a little, hopefully long, hopefully not too convoluted, but you now have on your website 878 deaths confirmed due to COVID. You have 1,150 deaths among cases. I think I understand the difference between the two, but essentially for a number of days now, the governor of the state of Colorado has said we've crossed this threshold of 1,000 deaths. And now magically we're back to 878. And I hear from a lot of people on a daily basis that they don't believe the numbers. How am I going to explain this change now during a week when we've been saying there are now 1,000 deaths and now, no, it's 878? What on earth are we to do here? And why wasn't this change made weeks ago when this could have been explained at a time when maybe the situation wasn't so polarized?
It's Eric France. I would say that for weeks now, as you can imagine, we've been running and running, and we've been using the nationally notifiable disease surveillance system for our definition of deaths. We've had our heads down working hard to be sure we're serving the people of Colorado to manage this. And through that time, we've started to hear stories about, are these correct or are these incorrect? And I appreciate the questions that came up and the desire then for us to look more closely at how we're posting and sharing our communication on information. The CDC has a specific list of the number of deaths due to COVID. The number 878 represents the number of deaths due to COVID. I think it was from February 1st through May 9th, as listed on death certificates and collected from the state by the CDC. And of course, even that number is going to be a low number because there'll be other death certificates coming in. There could be changes in those numbers. And so while we have 878 there, it's what we know today as the number of deaths due to COVID based on death certificates. we have been less focused on that because we've been thinking of this as a reportable disease in a national surveillance system. So we appreciate the attention so that we can make this distinction now. Going forward, we'll be sure that we list both.
All right, next on the line, I have Jessica Seaman. Jessica Seaman, you are on the line.
Hi guys, it's Jessica from the Denver Post. To kind of follow up on what Chris was saying, with the two separate numbers now on the website, how do we explain that the probable numbers to our readers? How do we put this in context when we've been reporting that there's been over 1,000 deaths? You know, how do we explain it to them in terms of what it means for the toll of this pandemic?
I liked what I heard Chris say. I think it was Chris who said there have been 1,150 deaths among cases and 878 due to COVID. That's a nice, succinct way of saying what the two distinctions are of those numbers. Either way, the numbers are too high and there's more to be done. We should be focusing as much as ever on what we can do to control its spread, making sure everybody's following our safer at home recommendations. And Rachel, if you have any thoughts too about communications or others on the phone, that'd be fine.
Yeah, thank you, Dr. France. I think you summed that up very well, that I think they're, you know, two different systems and they are counting things differently. And we recognize that that is challenging and confusing. I think it's just, you know, ensuring that you're using the terminology that Dr. France just shared, that Chris had shared also.
And this is Kirk with the Vital Statistics Program. I just wanted to add quickly to that too, that we anticipate that these numbers will converge eventually. There is, as many of you have heard me describe in communications previous to today, that there is a significant lag in the reporting of these deaths due to COVID as collected through death certificate and vital records registration, because of the time it takes to register a death certificate and go through that process, our sharing of data with the CDC for this coding, the exchange of that information, processing and incorporation back within databases to provide these provisional mortality statistics. So the lag used to be considerably greater, and we're in a better position now also to report on these deaths due to COVID as they begin to converge with the case counts as well, versus say even just several weeks or certainly in the early phases of this challenge where the lag was considerably greater and the data much more incomplete. So we hope that the data for the deaths due to COVID-19 continue to become more timely, more informative to this broader effort to complement the information about cases or deaths among cases as has been reported up through this point.
I think too, it's important to highlight how important it is to have a standard measure as we have with the notifiable disease surveillance system, a standard measure used across states. I'm always looking at what is our death rate? What is the rate in Wisconsin? What is it in New York? How many people are they going to have contact trace based on those cases? Does it potentially impact what the federal government decides to send the state of Colorado, our state's rates versus New Mexico's? And so having that standard measure, so I can be confident that the way we're measuring it and the way it's being measured in Texas or Florida are the same, really is important for the whole nation and how it manages this pandemic.
Next on the line, I have George.
Okay, George Devers, Montezuma County Coroner. Some of my questions have been answered, and I still have a couple other questions. You guys record every COVID case that dies, whether that is a cause of death or not. To my knowledge, you don't do that with influenza. Is that correct?
We actually do have similar criteria for other communicable diseases. So influenza associated deaths are not a reportable condition in Colorado except for pediatric deaths, and there are very specific criteria for pediatric influenza deaths that are followed. There are also criteria for influenza associated hospitalizations that could be a potential comparison. So these case definitions exist for many communicable diseases that are reportable nationally. And it is not uncommon that death certificates and surveillance case definitions for deaths of communicable diseases are sometimes divergent. Most of the time, the cases, as I mentioned when I was speaking earlier to the case definition, most of the time they do line up very closely, but there can be slight discrepancies from case to case.
Next on the line, I have Marisa Kwiatkowski.
Hi, everyone. Happens all the time. This is Marissa Kwiatkowski with USA Today. Can you please explain how you're collecting information on deaths in long-term care facilities? For example, when a resident of a long-term care facility is taken to a hospital and dies at the hospital, is that death counted at the hospital or the facility?
This is Rachel. If the death occurred among an individual who was a resident of that facility, the death would be counted as a death associated with that facility.
Regardless of where the actual death happened?
Yes, I believe that is true.
And are you getting that information reporting directly from the facilities, or are you using the same death certificate data for that?
Both. So we are asking for facilities to report information directly to us, and we have an investigation process where we or our local public health partners work with facilities to investigate cases and deaths that occur in those facilities. But part of our process is also looking at death certificate data.
Next on the line, we have Jeremy Harlan.
Hi there, this is Jeremy Harlan with CNN. Quick question, you talk about comparing apples to apples with other states. Are other states now have they been adjusting their numbers to similar to yours now that they're going to break it up into two separate sections? Have you seen that from other states, or is Colorado the first state doing this now?
This is Rachel. I'm not certain about that. I certainly do know that there are states that are, counting cases the same way that we are counting cases. I don't know if they are, separating out cases that have death certificates that are attributing the cause of death to COVID-19 versus, potential cases that are not. I'm not certain about that.
Next on the line, we have Matt Morrow.
Hi, it's Matt Morrow with Fox. I was just curious to clarify from CDPHE, have you changed a death certificate in regards to COVID, whether it be one from Montezuma County or from the living facility in Douglas County?
This is Kirk Ball, and I can speak to that. The answer is no, we have not. So whereas coroners, medical examiners, physicians have reached out to us, especially early on, to ask about how best to complete death certificates for individuals with or without COVID-19. We, again, are deferential to their best medical opinion on the matter, and we do not change death certificates and have not changed any death certificates in response to COVID-19 or other issues. I would add that if we, in our process of, in our routines for processing death certificates, if there's question about what was intended by certain phraseology on a death certificate or whatnot, we will follow up with that medical certifier and ask for clarification where needed. But again, any change to that death certificate ultimately would be initiated by the medical certifier.
All right, thank you everyone. This is going to be our last question. So last question of the day. John Carter with Mountain Ear, you're on the line.
You released the split data today. Will you be going back into the historical data at all and split breaking it out?
This is Rachel. Yes, we do plan to, going forward, provide clarifying information about the 2 different systems on our website, and that will be including deaths reported to date.
Okay, well, that brings us right up to about 4:45. We thank you all for joining us today for this, and I hope you have a great evening and a great weekend. Thank you so much.